My fellow Kenyan and African, how are you? My name is Samuel Sane from Kenya, and I'm here to represent Africa at large. I am at KIMS Hospital, a world-class hospital, and I love this hospital so much. Today I have a special doctor, very beautiful doctor, Dr. Nikila.
Yes.
Nikila Reddy, a specialist in women. We call it the specialty gynecology department. She is a gynecologist, and I would like her to introduce herself as we continue to ask her more questions and her specialty.
Thank you so much for your wonderful introduction of me. Okay. So I'm a gynecologist, obstetrician, and a laparoscopic surgeon, and a cosmetic gynecologist. So working since KIMS since a year now, and I have experience in my field. It's been 8 years.
8 years.
Yes.
In this specialty.
Yeah.
What is this department entails? What do you do in this department?
See, this department is regarding the woman.
A woman.
Yes. Not only taking care about the health of a woman, it's an overall woman well-being. The gynecologist, obstetrician, now the latest coming, geriatrics is there. We have a cosmetic gynecologist.
Yes.
So it's top to toe about a woman. Beauty is not only from the outside, and also the intimate part is what we do in a cosmetic gynecology. So we deal with all the issues of a woman.
All issues of a woman.
Yes.
We have so many cases of women complaining different diseases. What are the main and complex cases have you encountered in your specialty?
Yeah. So on a regular basis, day-to-day life, when we take a younger children or a younger girls, the main issues will be irregular cycles. It's a very common, irregularity that we come across. We encounter this. The complaints are they have irregular periods. This is because of their lifestyle. Nowadays, they don't have physical activity and they eat a lot of junk foods. As you have seen when you entered, I think Hyderabad, a lot of restaurants have been opened up. Late nights of dinner, having disturbed sleep, a lot of stress in younger girls. And because of all these factors, we encounter this irregular cycles, which we call it as PCOS or PCOD. That means a hormonal imbalance which we see. So because of this, they don't have periods regularly every month. They might be having once in 3 months or once in 4 months. And for some girls, they might get periods only when they take medicines. So this is a regular what we see in younger girls.
Younger girls?
Yes.
At what age?
Starting from the maturity, maybe from the age of 13 years, we have been started seeing this in a few years.
Yes.
Maybe in the olden days, they might have been very regular on their work because they do household work, they practice their walking, they cook themselves, they eat the home food, but it has been completely changed as the generation has changed.
Yes. Now there is this issue of irregular periods. I would like you to talk about it a little bit.
Yes.
Yes. What causes irregular periods?
It is mainly because of the sedentary lifestyle and food habits, as I said, fat foods what they eat outside, the junk food what they have, and because of these and lack of physical activity which imbalance our hormones, estrogen and progesterone, and also they have insulin resistance. So all these factors putting together will lead to irregular cycles.
It's risky.
Yeah, of course. Because these people in the later half of their life, they might face infertility problems. When they want to conceive, that time they'll come to know, okay, why haven't I changed my lifestyle previously? Why I haven't consulted a gynecologist regarding this problem? So they don't come to us so early. They come later when they get married and when they don't become pregnant, when they have pressures from their in-laws, from the family side, then they come up to us. Yes.
What is the remedy for this treatment, for this condition?
Yeah, we treat them with hormonal medications.
Hormonal medication?
Yes, hormonal medications.
And they recover 100%?
They will recover. Most of the women who follow a complete diet and exercise and medication. So it's a triangle. So it's diet, medications and exercise. They definitely
exercise and diet medication.
Exactly.
That will solve the problem completely.
Yes, they will at least it will resolve. 90% of the women
that is a
resolve.
positive.
But it should be dedicatedly done.
Let me ask you a question. In Africa, and rather, let me say my country, most of these young girls, they use these emergency pills to avoid the pregnancy.
Yes.
How do you advise these girls?
See, emergency pill, once in a while you can use, but not on a regular basis. If you use it on a regular basis, it will disturb your reproductive health.
Yes.
So it is not advisable on a regular basis. Instead of that, you can use condoms, which are very safer. You can use copper tea. You can use hormonal pills every 21 days, continuous hormonal pills.
They are safe.
Yes. So these are like safe methods which you can follow instead of taking emergency pill.
Yes.
And when you want to ask about the women's health, the one more important which I want to talk about is awareness of cervical cancer. So all the women before marriage, if we start from 13 years of age, they can take cervical cancer vaccine.
There is a vaccine for
Yes,
that.
it's a vaccine for
Cervical cancer?
Cervical cancer vaccine. It can be taken from the age of 13 years. So it's a 3 doses vaccine. Gardasil 9 has come recently. It covers all the 9 viruses in it.
Yes.
So it is taken as 0 months, 2 months and then 6 months.
Wow.
So it is advisable for all the girls from age 13 years and also women who have been married till the age of 55 years you can be.
Yes.
This vaccine is advisable. In a married woman or maybe in an older woman who wants to take a cervical cancer vaccine, it is always better that you screen for a cervical cancer before you take vaccine. So how do we do the screening? By doing pap smear. Pap smear test.
Pap smear test.
Yes, we take a smear from the cervix.
Yes.
So we make a patient lie down on a couch and then we examine her private part and then we put a speculum inside and we take the secretion of the cervix and we smear it.
Yes.
And then we'll send it for testing.
That's good. Another question, doctor. We have this issue of fibroids.
Yeah.
How do you deal with it?
Fibroids have many different categories in it again. This again depends upon what are the symptoms.
Yes.
So the patient, suppose if she comes to us and she complains that she is having heavy bleeding, severe pain, which we call it as menorrhagia or dysmenorrhea. With these complaints, if they come to us, we, depending upon the age and the family history and depending upon the completion of her family, whether she has completed her kids' complete family, then we will categorize them.
Yes.
So whether we have to deal it with hormones, whether we have to remove only the fibroid or we have to go for a complete hysterectomy.
Yes.
Again, when we come to a surgery, there are many types in it. We have a laparoscopic surgery and we have a robotic surgery.
Yes.
And we have an open myomectomy for that. So there are different categories of treatment in this fibroids management.
So it is treatable?
Yeah, it is treatable. Definitely, because fibroid is nothing but it is a mass developed from the muscle of the uterus. It is nothing related to cancer.
That's good. That's good news. There is also another condition known as endometriosis.
Yes.
How do you treat that?
Endometriosis, most probably they appear to our clinic with complaints of severity of abdominal pain and infertility. These two things. So again, endometriosis, depending upon the size of the cyst, we treat them. If the woman is young and she has to conceive, then we remove the cyst. We see how the leftover ovary is healthy or not, and we see their AMH value. That means how many eggs are healthy. We have to note that, and then we do surgery if it's more than 5 centimeters, and then we keep them on hormonal pills or monthly once injections are there. Hormonal injection, and then we treat and they can go for an infertility treatment. Because this endometriotic cyst, most of the times they release toxins into the uterus and also they might not release a healthy eggs or anovulatory cycle sometimes. So because of this they couldn't conceive because of this endometriotic cyst. And later half, if it's like they have completed their family and if the cyst is very big, more than 5 centimeters, 6 centimeters, we remove the ovary, complete ovary itself.
Completely. Now, that's shocking.
Because if once we remove the cyst, we are not sure that it won't come back
again. Okay, I understand. There's also this killer disease, cancer. What are the common cancers that you deal with in gynecology?
The commonest cancer which we deal in gynecology is breast cancer and cervical cancer. And then comes the endometrial cancer and ovarian cancers. So depending upon this, breast cancers generally we refer them to the oncosurgeons. And cervical cancer, uterine cancer also, if it's only confined to the uterus and there is no spread, we deal and we do the hysterectomy and we remove it, because there is nothing that we save the uterus.
Yes.
Suppose if there is a cancer in a younger woman who has not yet conceived, she has to conceive. For them, what we do, we take the eggs from the ovary, we preserve them, and then we do the treatment of the woman, so that she can go for a surrogacy or she can go for a donor, so that they can conceive through surrogacy.
That's good. There is also another major issue that is affecting our people: infertility in women. How do you tackle this issue of infertility?
Infertility.
Yes.
Infertility has a long journey to go with. So mainly infertility requires patience. Patience. Because they have to come for a long, for a longer duration to a doctor, having regular follow-ups with the doctor, because we need to check the female factor, the male factor also. So both the factors we need to check. So both play equal role in it. And then what are the cause for the infertility? If there is a particular cause for the infertility, maybe because of the endometriosis, because of the tubal block, because of the decreased eggs, as we said in PCOD and all. So these could be few reasons.
Yes.
And when coming to the male, maybe the count could be decreased, or the motility rate is decreased, or the healthy sperms might not be there.
Yes.
So these could be few problems which we deal with both them. And unexplained infertility again counts for 10 to 15%. For them, how much ever, if suppose we know there is a reason for the infertility, it is easy for us to treat. But for unexplained infertility, it is a little difficult to treat. But still, by going through IUI, IVF and ICSI, there are many successful pregnancy stories which we have encountered.
You have mentioned about IVF.
Yes.
Kindly, can you explain a bit about IVF and how it is beneficial?
So when we have decided that we are doing IVF, so first what we have to do, we will do a diagnostic histolab for a mother. We see the uterus, everything. We keep her prepared, and we see the count of the husband and eggs of the mother. So both of them we have to look into it, and then how healthy they are. And we counsel the couple about the IVF, because the success rate in IVF now it has been increased. It has come to 35 to 40%, but previously we used to have only 20% of success rate.
Now,
yes, because we have latest equipment. A lot of equipments have come across, which we are successfully doing IVF.
Yes.
So after counseling both the partners, we start giving hormonal medications to the mother especially. And when the egg has come to a particular size, we give an injection so that the egg releases from it. And then doing under anesthesia, we pick the egg, ultrasound guided, and we store them under a medium. And then at the same time, the husband is also asked to donate for the sperms.
Yes.
And then we do it in a in vitro fertilization.
Just like a test tube.
Like a test tube baby, exactly. Okay. And then once the egg is fertilized, we show to the mother like it's a day 2 egg, this is a day 5 egg, and so on. And then we will introduce into the mother's womb at a particular stage.
At particular stage.
Yes.
Wow, that is great. And there's no reason for people to complain, I have no kid, I have no baby.
Yes.
We have a solution.
We have a solution.
Okay, doctor, I have something I would like to request you. You have medical equipments that are latest, that give you a great assistance in your specialty.
Yeah.
Do you have them? Latest technology machines, equipment?
Yes, we have robotic. Because we are doing robotics for hysterectomy, myomectomies, endometrial cysts, for cancers, and to remove the uterus and all.
Yes.
And we have all the laparoscopic equipment. We have hysteroscopy, hysteroscopy assisted all kinds of surgeries we'll do. We have endometrial ablation. We have laser here to do for the vaginal dryness, for the vaginal infection and all. And we also do labioplasty, mineroplasty and vaginoplasty. That means tightening or loosening or trimming of the labia majora and all. So we have all the latest techniques, equipments, and also surgeries.
I would like to see them, if you don't mind.
Of course, why not?
I'll appreciate once I see them,
Yeah.
and also show my people in Kenya and Africa at
definitely
large the latest
yes
equipment we have for these procedures.
Of course, because we also have a team. It's not a single man show.
Yes.
We have a team for each and every specialty. Whichever difficulties we encounter, we can take the help of a specialist. We have a urologist, we have a oncologist, we have a plastic surgeon. We have each and every specialty is available in KIMS. So combining as a team, we can give a better care to the patient.
And the higher success rate.
Higher success rate.
Good. Thank you, doctor. I appreciate so much. Some of these things I didn't know, but now I know. And our people, now they're enlightened. And I believe you come to my country.
Oh yeah, definitely. You invite me, I will definitely
people,
come.
Our women, our girls, and advise them on the way to live and what to eat.
Yes.
Thank you, doctor.
Thank you so much.
Till you come to Kenya,
Yeah.
I appreciate. Have a good time. Wish you the best in your specialty, and may God bless you for doing a good work.
Thank you so much.
God bless you. Thank you.